Hello, everyone, and welcome back. Thanks for coming. I'm Tanya. I am the CEO and president at CanPKU Plus, and joined today again by Joanne, Lauren, and Suzanne. If you watched our first video, and I encourage you to, that's where I did some introductions on who these ladies were. And I'm going to have you refer back to there for that introduction so that we can get started and jump right in. So I'm going to pass it over to Empower Advocacy to start. At the end, we will have Q&A, and at that point, I will clip off whatever happens from there forward. So at that point, you'll be able to speak freely. If you want to text in any questions or raise your hand, we can address things on the fly, but it is better if you can wait till the Q&A to have those questions addressed, because it might be in the next slide. So over to Empower Advocacy.
Perfect. Thank you so much, Tanya. And thank you to all of CanPKU Plus for inviting us back today to continue learning about drug access and advocacy. So much to cover. So this is, as Tanya said, this is the second of our two webinars. And today we're going to discuss why your voice matters throughout all the processes that are involved in drug approval and reimbursement in Canada, and how you can become an effective advocate. So let's get started by taking just a quick look at the agenda. These are the topics that we're going to cover today. I'm going to start us off again with a bit of an overview of what advocacy is, why it matters, and what goes into building an advocacy plan. So very tangible stuff today, different than last week. And then my colleague Lauren will take you through how to put your advocacy plan into action for public reimbursement. And Suzanne Lepage is going to explain what advocacy looks like for private coverage and what you can do on that side of things, which is different a little bit than the public side. So as you can see, we've set aside some time, as Tanya mentioned, for a brief Q&A. So please note down any questions that come to mind as we go, because we won't stop, but we certainly will have a bit of time at the end. And also, I know that John and Tanya are always happy to receive questions after the fact and share them with us so that we can answer them then. So hopefully some of you have had a chance to watch the recording of the first webinar from last week. But if not, let's just cover off a little summary of what we covered on that call. So we think this slide, which is very busy and has lots of acronyms, sums it up best, what we talked about last week. And we reviewed all of the processes that you see on this slide, from Health Canada approval to a new treatment through to patient access. And we also discussed that there are three main pathways that patients can access medication in this country: public coverage, private coverage, and then out of pocket, which is where we pay for medications in part or all. There's a fourth pathway, which is compassionate access through the manufacturer, but that isn't always available to us. So as you see on this slide, for public coverage, the last step is when any or all of the 19 provincial, territorial, and federal government drug plans sign something called a product listing agreement with the manufacturer. And we discussed that all of these steps or processes represent opportunities for you to engage in advocacy to influence public and private drug funding decision-making. But as a reminder, and you'll see the turquoise box, there is only one opportunity for formal input from stakeholders like you in all of these processes, public and private alike, and that is the health technology assessment process, CDA and ENAS. And just a last reminder about what we covered, all of this can take anywhere from 2 to 3 years for a drug to be publicly funded once it's been approved in this country, and that can be longer, or in some cases, unfortunately, a drug won't be covered, but that happens really. And on the private side, what we're hearing, and Suzanne covered this, is that reimbursement is taking even longer as well, facing new and different challenges on that side. And that is why overall, finding opportunities for informal advocacy is so important. So let's jump into what we're talking about today. So What is advocacy and why does it matter? First and foremost, advocacy is about empowerment. It is both supporting people to feel empowered to advocate and the feeling of empowerment that we get from actually doing advocacy. So, advocacy can be many things, and you may have your own way of describing it. Certainly, we all do. But for us in the work that we do, we would say that advocacy is about taking action to create meaningful change that will have a lasting impact on the issues that matter to you and others by bringing forward your perspectives and experiences on important issues, by building relationships with decision makers and influencers who can then possibly become champions for your cause, and also by positioning you and your network and your organization, like CanPKU Plus, as trusted partners in bringing about change. And that is important. Advocacy is a lot about building trust. So here on the next slide, we'll talk about some different types of advocacy. But in healthcare, we really tend to see these three. And what differentiates them is who or what is being impacted. So in some cases, a public policy issue can be having an impact on many people at a system-wide level. And this can apply to something that's happening on the private coverage side as well. And that could be like the lack of patient and caregiver input opportunities, for example, in our drug review processes. In other cases, a limited group of people might be impacted by the same issue, and they choose to advocate together as a group. And that example could be access to newborn screening in a particular province. And then in the middle, there is individual advocacy, which is when an issue is directly impacting you, a loved one, or someone you are supporting. And an example of that is when you're denied access to a treatment through your private insurance plan. And that is when individual advocacy really comes into play. And often individual advocacy ends up helping others as well, and sometimes morphs into being a group effort. So whether you're a community or a group or an individual, there are so many reasons why advocacy matters. And most of these won't be surprising to you. But it is important and impactful, and it can really make a big difference in people's lives just by doing it. And here's just a few examples of that. So at the top, we certainly want to acknowledge that even though advocating to a decision maker can feel very daunting, typically these decision makers react and respond, not always well, but they do, to people who effectively bring their issues to the forefront of the broader agenda. And sometimes you even end up shaping their agenda for them by your advocacy. Next, we can say that governments that you are targeting will have, their own agenda and their own priorities, but advocacy provides you with an opportunity to make your priority their priority. Also, engaging in advocacy enables you to have opportunities to push when needed, and importantly, to gain some control over an issue and change your community, something that your community needs. This is really important because when we're doing advocacy, what leads us to doing advocacy is a feeling of a lack of control, a lack of power, and engaging in this work really helps with that. And the one thing that we always want to remind people about is that advocacy fills a void. And if you don't engage around an issue, it's very likely that no one else will. We can't wait to see if someone is going to take this up. And in that case, nothing is going to change. So very important to do this work. But most importantly, what we'll say is that advocating allows you to draw upon the power and the right that we all have to drive decisions and affect change that impact our lives. So just a little bit of some motivation there. So that's nothing you didn't already know, but it also bears repeating and enforcing that advocacy, especially in rare diseases, is so important and can be extremely impactful. So now let's move on to the fundamentals of how you can build an advocacy action plan to drive change. So to do this, we suggest that you first ask and answer 3 core questions. Number 1, what is your problem? This is the issue that you're currently facing and will become the focus of your advocacy. Second, number 2, what do you need to solve your problem? This is the action that you need to be taken and the outcome that you need to see. What is the, solution? And third, and this is really important for all of the advocacy that we do, public and private, who can get you what you need? This is the decision maker, the person who holds the power to solve your problem. Now, let's break these down a little further on the next few slides. When you're living with any disease or condition, we are faced with many challenges and issues along our journey. So when you're choosing to embark on advocacy, again, it's really important to decide where to focus our efforts. And that is an easy thing. It's not an easy thing to do, but often it's going to be the most immediate or most pressing issue that we're facing at the time. But the key here, and we can't say it enough, tackle one thing at a time if you can. Sometimes things are urgent and you've got to deal with more than one thing at once. We get that. But if it's possible to pick one thing and focus on that, please think about doing that. So once you've made that choice, the next step is to clarify what impact the specific issue or challenge is having on you or a loved one. So what is the problem that it's causing? Okay, you know the issue, but what is that problem that it's creating? And one thing to consider at this stage is that not all issues lend themselves to advocacy. So we suggest you take this test. It's really simple. Just ask yourself if your problem can be solved through advocacy, and can you identify who can solve it for you? And probably you want to flip those around, because usually if you can identify an advocacy target or a decision maker, then you're going to be able to do some advocacy to solve your problem. And we're going to talk about knowing who your target is in just a minute. So once you have chosen your issue and clarified what your problem is, and then it can be solved through advocacy, start thinking about what needs to be done to fix it. Specifically, what is that solution to your problem? And then you're going to determine what the call to action is, the thing or things that need to be done to get you what you need. So that sounds a little bit repetitive, but they're slightly different. And here on this slide, there's a couple of tips just to help you when you're formulating these important components of your advocacy plan. I won't review them now, but certainly have a look once the webinar is online. All right, number 3, by this point, you've probably got a good idea of who the target of your advocacy is or should be. And to make sure that you're on the right track, you want to ask yourself these questions. Number 1, who is involved? There may be a number of people who play different roles, for example, a supportive role, an influential role, a decisive role, etc. You also want to ask yourself, is your problem at the institutional level, or is it something that you need to go to government to solve, for example? And sometimes you end up starting in one place and you end up at another because you've got to escalate your advocacy to a different target or decision maker. You also want to ask yourself, who are the people who represent your needs, and how do they differ from your target? How influential are they around your issue? And we talked about influencers before. And the most important thing is to be clear about is who is the ultimate decision maker. And so this brings us to that person who is the target of your advocacy, because they can get or give you what you need. So another thing, we don't have it as number 4, but it is very important that you can do to help ensure your advocacy plan is effective, is to consider the whole ecosystem of all of the stakeholders who could potentially support you and help you to move your issue forward. So we've got 9 boxes here, they reflect some of the supporters who we can think of, but you might think of others. But keep in mind that healthcare professionals or healthcare providers like clinicians, nurses, dietitians, even genetic counselors can be really helpful in your advocacy. So think about them, as part of your network, your friends, family members, but also, local elected officials who are different than ultimate decision makers can be super supportive. And if you're part of a patient support program, you might want to think about how they can help you, with an advocacy issue that you're facing. You're going to think of others for sure. But what's important to remember is that you don't have to do this work alone. And we're going to come back to how you can leverage your network of supporters and advocacy when Lauren speaks to that in a couple of slides. But because you never know what connections other people in your life might have that could be helpful or how they themselves could help you, you need to think about, who this network of supporters is who are around you. And that brings us to the last slide in my part before I turn it over to Lauren. And this is an important one. So we talked about the different kinds of advocacy earlier on to be aware of, but also there are different kinds of advocates or roles that people can play in advocacy. So we wanted to introduce you to those and maybe just give some thought to this as we go along. We have people who enable advocacy. They build the foundation, the resources, and the capacity needed to enable groups and individuals like you to take action. Then we have those who empower advocacy. They provide the tools and the knowledge and the training that's needed to empower people to advocate, to bring their voices forward, to do that work. And then finally, we have those who execute, the doers. They amplify the voices of patients, of caregivers, they could be healthcare providers, all together to drive positive and lasting change. So think about who you are in this, whether you are or you would be someone who enables, empowers, or executes advocacy, or maybe you play a combination of all of these roles. So give it some thought, and we are going to move on to the next section, which is putting your advocacy plan into action. And I'll turn it over to Lauren.
Great. Thank you, Joanne. So now that you have determined your problem, what needs to be done to solve it, and who is the target or decision maker, as well as who can support you, it's time now to put your plan into action. So the following 4 steps are the key components for taking your advocacy plan from theory into tangible actions. So we're going to begin with the cornerstone of effective advocacy, which is key messages. So developing key messages is an area that an enabler and an empowerer or somebody like CAMPKU Plus can support with. And they may even be developing key messages that you can use for any advocacy that you do. But we did want to take a moment to explain what key messages are. So key messages are concise points that will guide you as you undertake your advocacy. They outline what the problem is, how that problem can be solved, and what the target or decision maker can do. They are often reinforced with supporting points based on data or your own personal experience. But the one key thing to remember is that the key messages should include your ask as the part of the call to action. That, again, is what the target can do to help you solve your problem. With your key messages developed, you can move on to determining now how you're going to deliver them. So here are some examples of commonly used advocacy tools, which are essentially vehicles for sharing your key messages in a compelling way that will reach your advocacy target. So in a few slides, we're going to review 2 of these commonly used advocacy tools, which are personal stories and in-person meetings. But to determine which advocacy tool you may use can vary depending on many things. So you will take a look at your advocacy tools and determine who your target is, your issue, the stage in your action plan, or the urgency of your issue. And all of that will help to determine which of these tools you will use. And what's really important to remember when deciding on which advocacy tool to use is that you likely won't use all of your tools at once, and you may use some tools more than once at different stages. And this is what we call layering. So as you can see from this slide, you may start with a certain tool or tools and move on to others as your issue progresses. So for example, Can PKU Plus may publish a statement or a press release on an advocacy issue to start. They may then call on you as community members to join them in a meeting with a decision maker to share your personal story. But then, which would be layer 2. But then, if the community is still not seeing change, you may move on to layer 3 and take part in a lobby day together to raise awareness of the issue on a larger scale. So, while this may sound or look a little complicated, at its essence, it's about picking the right way or ways that you are going to take action. And that could be using one tool one time or multiple times. Sorry, my slides are just having a mind of their own today. Uh, so, the first advocacy tool we are going to explore is your personal story. So, personal stories are a very impactful advocacy tool as they help to frame the issue in lived experience. This can help decision makers see beyond facts and figures and into how the issue is affecting Canadians on a daily basis. So, the details of how to write a personal story are a bigger conversation than we have time for today. But at a high level, what we wanted to outline is that a personal story involves a summary of what happened related to the issue at hand. So, your personal details, facts about the situation, a description of the issue, and most importantly, your ask. This should all once again be summarized in what you are asking of the decision maker. So now what about when you're meeting with the decision maker? So this is the other tool we're going to talk about, which is advocacy in person. So in person, or these days virtual meetings, could be an early or a first step in your advocacy, but it is also something that can and should be revisited as things progress. This is either to continue to push your issue or to keep the target updated as your advocacy progresses. As individual advocates, you may be at a meeting with the target independently, or you could be joining the meeting of someone else in your network, going in with a colleague or an organization like CAN-PKU Plus. But a few key things to remember, regardless of who is with you in the meeting, is focus on communicating your key messages. Understand your role and the roles of others in the meeting. Try to avoid getting pulled off track and moving the conversation away from the ask you are trying to make. And effective meetings are a conversation. So be sure to allow questions from the decision maker. You need to listen as much as you speak. And finally, end with clear steps and confirmation of who will do what and by when. So now that we've discussed the advocacy tools, we're going to move on to the third component of putting your plan into action, which is leveraging your network. So building and nurturing communication connections with the right people is at the heart of successful advocacy. And this is where we come back to that ecosystem of supporters that Joanne mentioned. Within that ecosystem may be others who share your concern and whom you can work with to present a united front and amplify your message, because more voices can strengthen a message. Further, you may actually be a member of someone else's ecosystem of supporters. So I've referenced a couple times CAN-PKU Plus, but you may be asked to support the advocacy work that they are doing. So while you may leverage your own network, you may be leveraged by others as part of their network. And the last piece to putting your plan in action is overcoming challenges. So So even after you've done everything that we've reviewed, your target or decision maker may not immediately give you what you need. So you'll likely have to overcome some challenges and hurdles. And so here are just some ways that you can help keep the dialogue going, even when you meet with resistance. So asking why, probing to find out what is their position on your issue and why they're making that decision. Sharing credible information. Ensure that any guidelines, published data, real world experience is what you're showing or is what you're sharing. Show you've done your homework. Use collaborative language. So focus on words and phrases that emphasize you want to work together with them to solve the problem. Be persistent, respectfully. Follow up, and follow up. You want to allow government an opportunity to make the change, but you want to make sure that you are staying on top of them to see that action being taken. Lean on allies. So again, we've mentioned a couple times now, you can see how important it is, those networks, that ecosystem of stakeholders, and those other people who can help amplify your message. And reference any policy or precedent. Has this issue been solved before in another disease area or with another group? Where can you reference action that they have previously taken that can be repeated or built on to support you? So with that, I'm going to conclude on public funding advocacy and pass it over to Suzanne to talk to you a bit about advocating for private coverage.
Thanks very much. For those of you that were joined us last week, if we move to the next slide, just to summarize, there are multiple different steps that are involved with getting a new drug reimbursed or covered for an individual patient. I think one of the things we need to remember is there's multiple stakeholders, including the plan sponsor who decides, often an employer who decides on the coverage and pays for it, and multiple different insurers and payers. So this pathway looks a little different, but some of the same principles apply. So if we go to the next slide. One of the key things is that there's two types of access in the private payer ecosystem. One is market access, and market access is getting listed on an insurer's formulary is the first step. And you can see that the drug may get listed by some of the insurers, but there may be patient access issues related to the plan design that's selected by the plan sponsor of your own personal benefit plan. And so teasing apart why this is happening is really important in directing your advocacy strategies. And so we'll talk a bit about that as well. So, what normally happens, again, this is just a bit of a refresher from last week, is that in advance of when your plan is set up by your plan sponsor, it determines how drugs are covered. And so when you go to the pharmacy, you put in your group number off your benefit card, you put in your own individual certificate number. The pharmacist inputs the DIN number, the drug identification number, and in real time, they get a message whether it's covered or not covered or requires prior authorization. Today, we're going to talk about when you get a message that it's not covered, what can you do about that? So what happens when your drug is declined for you personally? So again, we're not talking about a systemic issue, but your plan, your claim was declined. And so a couple things to need to think about. We really need, and this is often supported by patient support programs and other things, is why was the claim declined? And we have to triage that. So we need to understand why it was declined so we could customize the strategy. And so I have a couple of examples of that I'm going to talk to you about. So if the reason it's declined is because the insurer has made a formulary decision about coverage or not covered or criteria, then in those cases, you need to target the insurer because the insurer has made the decision. But often, in many cases, the patient access issue is because of the design that's been chosen by the plan sponsor. And in that case, the employer or the plan sponsor has to make an exception. Let me give you an example of that. So a payer could have decided to list the drug, but your own plan sponsor chose to have a private plan that mimics or copies the provincial formulary for the province you're in. So if you're in Ontario, can you go back one slide? I'm going to just explain it and then, yeah, thanks. You could be living in Ontario, and although you have a private plan, your employer chose to copy the Ontario drug benefit. And if the Ontario drug benefit does not cover that drug, the insurer can't legally cover that drug because they are following a program that was contractually agreed to between the insurer and the plan sponsor. So this is why it's really important to triage. So if we go to the next slide, here are some examples of when a payer decision might affect it. So they may choose to access only one preferred drug in a category. So in a lot of disease areas, there may be 3, 4, 5, 6 different types of drugs available, or they may only provide access to older drugs. And so they may not see the importance of patient access to multiple medications. And that may not be multiple medications at once, but that they may have tried or failed an older or another drug and they need access to newer medications. There may be patient needs beyond the payer's criteria. So the criteria may be set by the payer, but that may not align with common practice in Canada, for example. And that's an example number 2 as well, right? So that if the payer made the decision that's causing the roadblock for the patient, then you need to target the payer to discuss why the drug is not covered. And we'll talk a little bit about that as well on how to do that. But even if you go through these payer steps and you're unsuccessful, there is the option, which we're going to talk about in the next section, of targeting your own plan sponsor to say, hey, I already contacted Sun Life, Green Shield, Manulife, and it doesn't seem like I'm getting the coverage I need. You as the plan sponsor who sponsors this plan, let's talk about it. So we'll talk about that as well. The next one is some examples of the plan sponsor decisions. So in these situations, it's the plan sponsor that decided, for example, to put a plan maximum on. So a plan maximum is usually implemented to save on drug plan costs, and a plan maximum could be 250,000, it could be 1,000. It's really up to the plan sponsor. But that is a decision that your own plan sponsor made. We talked about mimicking the provincial plan, or they may have chosen a more restrictive formulary that doesn't cover the drug that you need. In these cases, the plan sponsor is the ultimate payer, and they have chosen this benefit plan design, and they've signed a legal and financial agreement with the insurer for that coverage. And so the only person that can provide an exception or allow the insurer to go beyond what's in that contract is the plan sponsor. And so in this case, you would have to target the plan sponsor. So much like we heard earlier, is understanding where is the problem and who is the decision maker that can affect some change on that problem. You can't go, for example, to an insurer and say, pay beyond the plan maximum because I need this drug, because they didn't decide on the plan maximum, the plan sponsor did. So it's really important that we understand, is the problem a process problem or is the problem a clinical problem? I've seen time and time again in my work that when making an appeal or an exception, the doctor, the patient support program, whatever, inundates the payer with information about the clinical need for the drug. But in reality, when we dig deeper into the reason for the decline, it's a process issue is the reason for the decline. And it's not a matter of looking at the clinical data, but understanding the process and looking at identifying the process. So again, it's really important to use the right tools in your toolkit to target the right problem. So there's really 3 types of strategies. And again, these are very similar to what we saw earlier with government. They just have a sort of a different layer. So the first one is a payer appeal, so that you appeal the payer's decision on a specific patient. Often this includes the physician, where you look at the decisions that are being made for this patient and recommending something different. In some cases, it may be, I've experienced this, where the payer's using a criteria for a certain test that would not be appropriate at this stage in the patient's management of their condition. It may be that the test is not readily available to a Canadian at this stage of their condition. So some kind of appeal where you're going to the decision maker on the private plan to say, hey, this doesn't make sense. The other one is a plan sponsor exception, where the patient goes to their plan sponsor and says, hey, the coverage we have is not meeting my needs. The one thing about this is that there sometimes is some discomfort. This requires the patient to disclose their condition or their family member's condition to their plan sponsor, which is often their employer. Could be a union, could be other things. And not everybody's comfortable doing that, but that is required so that you can go and say, hey, Mr. Employer, I need this drug access for this reason, and I'll give you some reasons to use in a minute. And we need you to consider an exception. And so there's a whole process for that, but that requires disclosure. And then general advocacy is when we advocate directly to an insurer or payer where it's not patient specific, but it's a systemic issue affecting all patients. So it could be that, Joanne mentioned at the beginning that it can take 18 to 24 months after Health Canada approval to get it covered, and yet this drug is needed. You might want to look at processes and procedures. So it's advocacy on a broad level for all patients and not necessarily a patient-specific situation. So these are the sort of three types. Yeah, can you go ahead? So a payer appeal in terms of best practice, and again, this is just a starting point. We would definitely get into more detail. Is first of all, you're telling the payer, okay, you declined my coverage, and here's why. So, it's sometimes you're reminding the payer what they did because they deal with thousands, if not millions of claims and prior auth. So you're just trying to tell them why it's happening. Describe if there are some specific patient exceptional circumstances. And so I use the example because it resonates. It reminds me of they required certain tiered treatment. So try treatment 1 and then treatment 2 and then treatment 3. But one of those treatments would affect female fertility. And this woman who was dealing with this disease wanted to have children. And so that was an exceptional circumstance that they'd like them to look at things differently. It's also important because workplace benefits are part of remaining active in the workplace, avoiding disability, improving productivity. So explaining how that condition, that personal story, impacts their ability to work and the quality of life they have or need. And so that can affect them both as a caregiver as well as a patient. The other thing is to remind the payer other treatments that have been tried and maybe failed and the unmet needs. So again, the patient-specific situation of, they have tried options 1 and 2 and they weren't successful for these reasons because they may not have that history. And the other thing that I like to have people include is this new treatment that they want. How will that impact their ability to work and the quality of life? But also, if they were denied this treatment, how would that impact the workplace? Because again, these are workplace-sponsored benefits. So all these things would be helpful to be included in a letter. Next. A plan sponsor exception is slightly different because you're going to an employer that doesn't necessarily have a medical or clinical background. And really what you're trying to get them to do is look at the request and forward it to their insurer to execute. And so again, summarize a bit why the plan excluded it, explain how the condition that you experience or your family member experience affects your ability to work productively. Again, summarize the other treatments that you've tried and why there's an unmet need and how this treatment will impact your ability to work and quality of life. I've talked to plan sponsors throughout my career on a regular basis, and I've also seen market research, and most plan sponsors have no idea how their plan members benefit from these treatments or how they benefit when they're not covered. And so your story that you share with your plan sponsor helps them say, whoa, I had no idea. Let me look into this. Because as long as they don't have complaints, they think the plan's working just fine. And advocacy, we talked about it earlier. It's a very general level. It's not patient specific, but you may come together and say, why is it taking 24 months to cover this drug? Why are you using this criteria, which doesn't make sense? potentially the way they're managing their drug plan. So there's different ways, but you're not necessarily going in and saying, I want coverage for Suzanne or Joanne or Lauren. We're going in at a broader level to talk to the payer about how they manage the plan for that condition. So with that, that's my formal presentation. Turn it back, I think, to Joanne and Lauren. We have time for discussion and questions, I believe, unless there's a wrap up. I'm sorry if I preempted that.
Yeah, no worries. Thanks so much, Suzanne. And it's great. We do have 15 minutes left for Q&A and discussion. But, just to say, obviously, just from all of this, there's a lot here. We realize that it's a lot to take in, which is why we're so glad that this is being recorded and people can watch it at their leisure, even in chunks, to sort of, maybe today I'm going to learn a little bit more about public and then tomorrow I'll shift to private, or whatever you think is most relevant to you. But, there's a lot of similarities in this work, and there are also some fundamental differences too, from the way that drugs are reimbursed on the private side versus the public side. And those are all important to understand, but we have some core fundamentals, that are really common to both, that it's great to sort of, have some insights into, so that when you're planning your advocacy and executing your advocacy, you have a greater chance at succeeding. And so we hope that you've enjoyed this, and certainly look forward to any questions that you may have.